Yeah. All right. Hi, everybody. It's so good to be here with you, both in person and online, and especially in person as like my phone is buzzing, so I'm trying to get a watch, and it's like you all had some bravery to get here tonight, so thank you for that. Yeah, exactly, exactly. I think one of the things I was looking forward to is that I do this work in the school district. And I recognize that this work is a community effort. And so while I so much appreciate what I'm going to share, I also want to put it in the context of the work that's happening kind of county and community and statewide and nationally, right? So I think that is, well, I'm super happy to be here representing MMSD. I just want to also just say thank you to all of you, because I know you're kind of here representing the community in different ways. I'm currently the director of mental health. And was a school psychologist in their schools, elementary, middle, and high across the way for 20 plus years. I'm the parent of 2 MMSD grads, West High School for me. I've heard there's a lot of Memorial folks in the room. And my dad was a West High School grad. So I always think it's kind of fun to think about how deep my roots are in this district. So we can flip forward. We started with thinking a little bit about the MMSD strategic framework goals, because this really centers our work. And if you look at these in the lens of mental health and well-being, you can see that they're absolutely inextricably, what's the right word? Connected. Did I get close? Yeah. They are just absolutely connected and foundational to these strategic framework goals. Next. They're also very connected to our core values. Right, so we can't do any of this work without thinking about our students' mental health and well-being. So what is mental health and well-being? Our plan for today, our goal tonight is to do a brief overview of a really complex topic, y'all. So I'm gonna hit it at a pretty high level, and there's gonna be plenty of room for us to have deeper conversation as questions pop up. So feel free to kind of note those or to let me know, and I'm happy to dive in. And I think there's lots of room for us to have some conversation. So now we're going to start with the definition. So I think one of the things that's really important to me when we talk about mental health is that I always talk about it in the realm of mental health and well-being. I think often we think about mental health as far as mental illness, and to me that's an insufficient definition. And so this is from the Wisconsin School Mental Health Framework. And really, we want to think about that everyone has mental health. It's a state of well-being, and more than just an absence of illness. So some students that I worked with just shared this definition with me, is that well-being is when your coping outpaces your stressors. And they just said it, I talk about this, that's my own framework, but they just said it so beautifully and so succinctly. And so this is our work, right? Is to promote well-being by reducing stressors where possible, and increasing coping through teaching skills and offering supports. So if I'm going to really just pull all the rest away, that's what our goal is how do we equip our students to be ready to walk out into the world that their coping outpaces the stressors in their life. And our students are clear that that's what they need. And I think that we can get into a lot of other, the media brings a lot of conversation and wants to direct us in a certain direction, but I always come back that we really are looking at mental health and well-being, so that we're really looking at where the students can function in a way that they're thriving, really. So this is data from 2021, I think. This is mostly from our Dane County Youth Assessment, and it was done during COVID. So the Dane County Youth Assessment is something that's been going on since 1980 something, a very long time. And the new round of data is collected and being analyzed. But we know that our students tell us that life has not been easy for them. We know that the struggles continue or have even increased from the point that we have this data up here. And the brand new data says, we continue to have concerns from our students around anxiety, depression, loneliness, suicidal ideation, right? There's some things that are not a surprise to us. We talk about this a lot. But there's some historic risk factors that we're starting to see level off or decrease. So I think that while there's always room for like recognizing the challenges that our students are facing, there's also room to recognize that they're building a lot of coping skills, and some of those historic risk factors are decreasing. So overall, when we work in the world of school mental health, is that we pretty much lean in on the statistic about 1 in 5 students struggle with mental health concerns. But here what I want to emphasize on this slide is that all students benefit from learning health and well-being strategies, right? So we can categorize you any different direction, but really any one of us, and I'm still learning, I learn every day about what is it that I'm going to practice to support my well-being. And so we know that supporting students' well-being supports their ability to learn. And in MMSD, learning encompasses both academic and social emotional learning. And so sometimes you don't see mental health or social emotional learning like right there, right in the middle of a strategic framework or a goal, but it's always underlying that, right? Without that, you don't get to the math scores increasing or whatever, right? So it's often invisible, but it's really there, and it's really foundational to us moving all of our goals for our students forward. Okay, next slide. So there's a lot in the slide, but I really, really like it. A couple of points that I really want to emphasize is that schools are really well placed to influence the well-being of our youth as we connect with all of these different factors, right? So there's lots of different factors that can shape the mental health and well-being of our young people. But if you look across these, schools are a touch point often all the way across these factors. Also, schools cannot do it alone. This is the work of the community. And I also want to use this slide just to remind us that mental health and well-being are key to our work as a community around social determinants of health and equity. So while schools are often one place that we're working on that, it really is our job as a community to be making sure that our students and our families are well, because there's a lot of things that happen that influence their well-being, that schools sometimes have control over and sometimes don't, and also some things that schools can influence more than others. And if we're going to really have a well children, there is a bigger response outside than just outside the schools. And we are key to a lot. We can make a lot happen, but not necessarily as well alone.
Chris, can I stop you for a second and go back to that? When I work with other communities and funders in those communities, this is a piece that would go a long way in helping them understand the holistic and systemic context of school mental health. Because there are some communities that believe mental health doesn't belong in the schools. So this is a very compelling and clear.
This came from this is a national from the I believe this came from let's see. It's up there on the top.
World Health.
Yeah, it's definitely, it was, and I think it might have come from a report that came from the Surgeon General.
Oh, definitely the who's determined.
Yeah.
Oh, yeah.
Yeah. So, and Steve, I can always share these slides. So, but I really love this slide. There's another slide that I often use that I didn't put in today because I could just talk about this all day. But there's been some really important studies about kids who started treatment in the community and kids who started treatment in schools, and significantly more completed their treatment protocol when they were in schools. And this was a time of Hurricane Katrina. And, you know, again, like there's a lot of places that are making a lot of efforts, and we need everyone. And schools are often the place where we can kind of work to kind of, again, influence all the way through. Okay. This is also a lot of words on one page, and some of you have seen these triangles and are, you know, kind of tired of them, and others have never seen them before. But what I really wanted to share is that school mental health is not just one thing. It's a whole package of resources and supports, and it goes all the way from things that we offer to all of our students down there on the bottom of the universal supports to things that we offer a handful of students up there on the top with the intensive supports. And sometimes what we talk about a lot are those intensive supports, but I really want to say that as I'm like thinking about and working with my staff and the staff out in schools, we really have a wide range of menu and supports for our students and families. The other thing that I really want to do when I bring the slide up is to really talk about that all of these programs rely on our phenomenal student services team. And so in our schools, we have nurses, we have school psychologists, school social workers, counselors, and of course that relationship that kids build with their teacher, right? All of those things are what we do to support the well-being of our students. And so I just want to, every time I talk to folks, do a huge shout out to the work that those folks are doing at our schools every single day. And also to recognize that we really do this work, in a context where it's a wide ranging menu, and that sometimes it's easy to talk about one program or one approach, but really we are always sort of thinking about the full puzzle, the full picture, to make sure that we're sort of serving the students at the level that they need. Let me see what else I want to say about that. Oh, this is the other place that I really want to highlight a huge gratitude to our community partners. So a lot of this work is what we do in our school, and sometimes we have very intensive partnerships that we spend a lot of time and energy building and maintaining. And so sometimes those are community partners that are coming in our schools to support this work. So sometimes it's MMSD doing this work, sometimes it's MMSD doing this in conjunction with partners, and sometimes it's that we're supporting our community partners doing the work out in the community. So there's a wide range, but all of those connections are important, and always that's something that we're nurturing to make sure that families and students are getting what they need where they need it. I think, oh, yes, next one. So this is some highlights that our team brought out last year. We don't always take time to brag about some of the work we do, but I think Melinda used great language just to say, like, the work we do has a tangible impact and it can be measured. Sometimes it's a little elusive, but it really is something that we are tracking and that we very carefully tend to. So we really are looking at what our students are accessing, how well it's going. We look at data. And so here's a couple highlights from last year. One of the things that I want to really highlight here is that we really, with some of our funding that we've brought in the last few years, we've really worked on making sure that our students can access these programs. And one of the ways we've done that is to bring in a mental health bilingual resource specialist. So someone who is a trained medical interpreter to make sure that when our students are accessing these services, they're accessing them as seamlessly as possible. We've also brought in a mental health navigator, a bilingual mental health navigator, to make sure that, if any of you have ever tried to make a doctor's appointment recently, it is not easy. And so really working to support families in getting connected to resources either in school or out of school. And that has made a real difference for some of our students and families. Couple other things, our school-based health center, we now have that launched in 4 of our comprehensive high schools. We'll talk about that in a minute. And we do a lot of screening in our schools for mental health concerns, and then follow up with interventions. So we know that we're letting teachers know what to look for, but we're also having some ways that we're proactively checking in with students to see how they're doing and to see if they need anything more. I think we can go to the next one. So this slide I actually really love, and it's really complicated, but part of why I love is that it's complicated. So as Steve said, I want to hear you talk about your braided funding model. Here it is. So I tell the story sometimes that when I first started in this job, I don't know, 6-ish years ago, there were 2 funding sources that I was working with. And now, depending on the different grants and things, I've had up to 12. So it is a complicated budget picture.
And very little of that is local.
Very little of it is local. And so we're so grateful for all the different sources of funding, and it makes for complex work sometimes. I feel like I spend a lot of time putting puzzle pieces together. Nicole and I have had some of these conversations. So really, I see it as my job is to make sure that we're using this funding and absolutely, I just always want to be a good steward of the funding that's coming in. And it comes in a lot of different ways. And all of these have different start times, different end times, different things that they cover, things that they don't cover. And so we really are always working very hard to make sure that we're being good managers of this that's coming in. And I just want to say, as strongly as I can, for mental health programming, we need stable, reliable funding over time to build those intensive partnerships that we need. And to also implement them with fidelity, right? We could just say, sure, come on in and do a 1-year thing that isn't gonna, it's not gonna last, because, and that's a lot of work on people's time if we're not putting in the effort to implement it well. And so we really make sure that as we're looking at our programs, they meet a need. And then we really spend a lot of time thinking about building those relationships and building a really strong implementation plan. The other part to do that is that we need those resources of people, time, training, materials, coaching, right? That's all part of strong implementation, and that takes money, both in funding and in people time, right? So sometimes we'll have funding, but we don't have the people time, or vice versa, right? So it's a lot of pieces to tend to, and I just respect the time of our staff in a way that I don't want them to be bringing something in that we know that we can't figure out a way to sustain. And it's not good for students either, right? If they build a relationship with someone or are starting to rely on a service, we need to make sure it's something that we're putting in that we can rely on over time.
Kristen,
Yeah,
could
please.
you talk about how much the loss of ESSER funding is going to mean in terms of the mental health?
Yeah, so we were really lucky to get a bunch of things boosted with our ESSER funding. And so and I knew it was going to be funds that was going to go away. So we have, let me see, I think 4 of my staff that were on ESSER funding, that we now have a plan for next year, but we don't have a plan for them beyond that. And so again, without staff to support implementation, I don't want each school to have to figure this out on their own, right? There's some things that are just better done centrally. So I have a plan next year. We've got plans for some of the DPI flow through funding and the Get Kids Ahead funding. And then we wrote a grant, or we've got someone to pay for 2 of those positions the following year. So this is the puzzle, right? That I'm just pushing out. And you can imagine how much time I'm spending.
Yeah.
What's the gap of those positions, the dollar gap?
So I would want to go back and look at that, but I think when you look at positions and each position with the benefits and things like that, I generally look at about $100,000 per position. I mean, give or take, right?
So the number of positions for which you don't have a funding plan?
For this year, none, but moving out,
For next year.
for 20, so by this year, I'm already thinking about 24, 25. So I'm good for this year, I'm good for next year. But then the following, I think I'm short 1 position right now for the following year. So around 150,000.
For 25, 26.
For 25, 26. Yeah.
You're
Yeah.
better than a lot of school districts.
I'm doing way better. I'm sleeping way, I've had some teammates who said where are you with this? And I'm like, but the day that I started the ESSER funds, I knew people were like, well, what are you going to do about this? And I said, I'm going to start knocking on doors. I told Melinda that. I'm like, I know that, it's nervous making to put people on, funding that is going to go away. But I also knew we needed to do that if we were going to stretch and grow. And I knew that's what we needed to do. So our mental health navigator and our mental health BRS went onto local funds this year. And so that is something that the school board has stepped up and said, we think that this is important, or half of each of their positions have. So each time that happens, I have a little happy dance, because that's my goal, is to take more and more of our funding and put it onto those reliable long-term funds. And so that's always my goal, is how do we start taking, we build some of these programs, we try some of these things out, but then we need to start building them where it's just reliable long-term funding. So we're getting there. I think, as a larger department, there's a couple positions that will be continued through ESSER funds. So that's hard as a colleague, and for some of our work, like in social emotional learning and things like that. But as, we got a Stronger Connections grant. So I think we keep It's a lot of work, you know, but we're writing the grants, we're getting them, and that helps. So, yeah. Did that answer your question? So rocky, it was rocky, and right now it's turned out better than, and I also, you know, we had Roots and Wings funding, right? So like there were some times when I was like, well, what are we gonna do? And I said, well, I know we've got this, that we have some discretion to be able to make some decisions with. So that helped too, to know that, you know, today this is gonna pay for this, but tomorrow this grant came in, so now it's gonna pay for this. So my stories with Nicole are often changing, which is amazing. Which so, you know, that's been so, it's been so helpful for me. So, so I think that, I think the other thing I wanted to say on this slide is that our community partners also need similar supports. There's been an increase of costs on all like sides, right? So just while we have increasing costs as a school district, our community partners have also have increasing costs. And we also often face other similar barriers. So while we have barriers around funding, we also have barriers around our pipeline of workers, right? So nationally, there's a shortage of workers in the arena of mental health and well-being. And so sometimes we have the money, but we don't have the staff. So that's tricky too. So, and then I also wanted to use this just to do a shout out to those of you who supported all this work through advocacy with our legislator and support through donations and partnerships. It's just really made a difference in navigating a really complex budget picture. So that's always really, really helpful. So what's on the horizon? We know our student needs are not going to shift. I mean, we know that there's some things that are getting better, but the student needs are there and they're going to be there. So a couple ways that we think about this is that we really, again, this is in my way of like being a good steward of dollars, is that we really want to work to fully implement and build sustainability for our new programs. So with our school-based health centers, which is a way that we're bringing into our high schools expanded physical and mental health services, we're really working to make sure that we build a long-term funding stream for that. And continue to work we've got a really good solid base for our mental health, and we need to continue to do that within physical health. If you really want to get into complex picture, I'll start talking to you about how some of our funding stream in this arena is billable services. And so that we're working with a partner who is billing insurance, and that's a whole nother conversation. But the things you learn when you're doing this job, and that my community partners are sharing and teaching me every day. We also want to continue to expand some of our foundational programs. Our behavioral health in schools has been where we have a school-based community hired clinician working currently in 16 elementary and middle schools. That's been a long-term program, and that, you know, we get a lot of asks to expand, which we haven't necessarily because of funding, and also frankly with community shortages of clinicians, which has made it hard to expand.
But this isn't one clinician in each school. This is
about
one clinician for all 16?
No, this is about our model. Our core model is a half-time clinician in each of those 16 schools.
Okay.
And then there's been a handful of those that we piloted to move up to a full-time clinician.
Okay.
What about expansion of the school-based health centers too?
So those right now we're in the building phase. So I'm not ready to expand that until we get that solid. Right now we've got the behavioral health part, so our expansion is to want to move into more of the physical health side of that equation. So expansion, but not necessarily to move more schools yet. We need to kind of keep building that model and that program. But our four comprehensive high schools do each have a clinician assigned there. One needs to be hired. Someone loved her job so much she took it back to her community. I'm like, I appreciate that, but and then you know, we also, like I talked about, we want to keep building our stronger funding foundations. So we have more money that we can rely on in a regular way. And then there's some other places where we want to just keep expanding our current funding opportunities. One of our grants right now is that we're working with the UW School Psych program on a federal grant where we're training new school psychologists. And we're doing a lot of that, and especially supporting diverse school psychologists, and also with them really specializing in mental health and well-being. So we're really excited about that. And the grant pays for their way up through their second year, but it does not pay for their third year internship. And so we can hire them as a district, but it would be great to be able to pay for them to be in a school to get their internship time. And we could actually then work on them doubling up with a current psychologist, which would then of course provide tons of benefit to our students. So that's one of my newest ideas is like, the more that we could take one of this really beautiful current funding opportunity and stretch it by making sure we had funds for those folks to do internship. There's just a win-win about really training our brand new school psychologists as well, and with a lot of extra support. They like this idea. I like this idea too.
What's the source?
The grant right now is federal funding, and it is the model school psychology. Can you go back to our funding slide? It is the model professionals grant. Yeah, our mental health demo project. We have about 5 grants that all have almost the exact same name. So it's the mental health demonstration project. And when we got it, it was in a lot of got a lot of press about it, Steve. So if you want me to send you anything, it's a very exciting grant, and it's actually a national grant. Lots of school districts have applied for this, or like agencies like UW School Psych Program. I think they're really working to work on that pipeline issue. And it's exciting. In fact, I meet with those folks tomorrow, and I love meeting these new baby school psychologists. It's so fun. We can go on to the next.
Kristen, can I just ask, which I'm sure is a
Yeah,
dumb question,
please.
but when you talk about physical health,
Yeah.
I mean, we have nurses,
Yes.
but I mean, most of them are part-time,
Yeah, so it's really looking to expand the work that they already do. The school-based health center model is a national model that's been nationwide for, I don't think 30 years is exaggeration, at least 20. And it's really a way to look at how do we expand school-based services. And some are very much like co-located, like where someone puts a clinic of theirs in a school, right?
Okay.
Or sometimes it's even where it's an outside door and the whole community comes in to use that, right? So it's a very robust model. I think what we're looking at as places to start are things like, can our nurses start doing more sports physicals? We've been really working on expanding our vaccine clinics. What could we start having them be able to do some basic lab work like strep tests? So there's some like basic kind of services that we just know families struggle to get their kids out into the community for. And then there's like a whole wide range of ways that can be, but we know that it reduces out of seat time, right? Kids can be seen in a school that they they miss less school, and families miss less time. It's a good thing for the community too. And it's a very complex work that we're just on the beginning parts of really thinking about how to work with our partners there. But some of the parts that we're we're making some great progress with are things like sports physicals, immunizations, some things like sexual health, some things like that. So yeah, so yes, we have nurses in our schools, and this really allows us to bridge into, and of course, another thing that's super important is bridging back to their primary care person, right? So if you do a sports physical, a big part of that can be to make sure, do you have a home clinic? And how do we make sure we get you connected with that primary care doctor? So yeah, did that answer your question?
Yeah, I mean, I'm just thinking of our elementaries that are community schools.
Oh my
gosh. Logical.
Yes, yeah, there's a lot of room to expand and grow this, and the state of Wisconsin is really behind in this model. So
And I will be one of only 2 states that embrace this.
yeah,
The other being,
I can't remember.
I think you told me Indiana,
Yeah,
so
something.
I'm
Yeah.
the kiss of death.
Yeah.
But it's also,
Well, I was visiting my daughter in Ohio over spring break because she went with her boyfriend. And I was like taking pictures of my team of like I would be going by these schools and there'd be these signs like come on in and get your healthcare needs met. And I was like, oh, someday we'll have signs.
So I want to tell you that in the eighties, so I was on the Madison School Board in the eighties for 8 years of that decade. And we looked at some models for the school-based health services.
Yeah.
And, but it was not anything that people were really ready for then. And it's too bad because it's a great model.
It's a great model. And I think that our community has worked really hard to figure out how to wrap around some of their students. And I think that we don't want to interfere with any of that work, but we do think that we could be a beautiful complement to some of the work that they've already done. But like looking for funding and a reasonable like reimbursement model and things like that is tricky and it's important. So we're gonna keep working at it and chipping away at it. Yeah. Oh, okay. I get to tell you about this exciting project. So we had feedback from our students and community that our mental health and well-being supports were not always clear. It's sort of a best kept secret sometimes. So we were really working on a campaign to increase the awareness of the work that we've been doing for many years. And to ease the navigation and connections to school and community resources. So we worked with a communications company, some of our ESSER dollars, to really develop a website and printed materials to make sure that we are much more in front of folks with these services that we offer. So this is our introduction to our 5 to Thrive campaign. And then you can go on to the next slide. And this is the website. So feel free to hop onto our website and look at what we're up to. We have 3 or 4 current pages. There's sort of an introduction through this site, and then there's a resources page. And early in the building stage, but I'm learning words like wireframe right now. So you never really know what skills you'll be learning when you walk into work. So Leo always says, Kristen, who are you? And what words are you using? But we do. What was that?
Can you share how much it costs?
To do this?
Yeah, or is it not?
No, I don't mind sharing, but I want to think about it for a minute because we did it in 2 phases. So let me think about it. I know we actually were just talking to Green Bay about this because I do think like it's really important feedback from our students and our family of like we don't know what you do or what you have to offer, or we don't know how to access it. So our students really said it needs to be clear, it needs to be more in front of us, we need teachers to know, and we need ways that we can get some support and navigation of some of this work. So early steps.
A really basic question, the five.
Yeah. So 5 to
5 services.
It's like 5 different sort of qualities, and so it's like I should be able to just not
Okay,
that,
sorry,
but it's basically like connection, community.
Okay.
So thriving, I think, is one of the 5 to Thrive. So yeah.
Strategic pillars.
Yeah. So it's like different nuggets, and then those are ways. This is the beautiful part of working with a communication company is that then they sort of like name like what we do to support mental health and well-being, like connections is one, right? So like we connect you with things in school and out of school. So and then it's also a lot of us like remembering that when we talk about these things, we can talk about them in a little bit more simple ways than how I tend to talk about this work. Because it's easy to get into the details and the weeds. And then, it gets very confusing to families. Like when you say you go to the school psychologist for this and you go to the school nurse for this and whatever. And so like we really simplify some of this to say, if you need supports, then you can talk to a teacher or a school staff member, or you can go into your school health office. Because if you don't feel well, you go there. And so like, let's not get into
Stigma.
yeah. So like go there, and then we created a whole package for our schools about if a student enters sort of the need of supports within the school health office, how do we make sure then that they get connected to the right group of people in schools? So it's been like really interesting work to support like the back end of this. And just, you know, hopefully it will continue to see that, you know, students and families can see this messaging, it can start making a difference. They can feel a little bit more like they know how to navigate what can be really complex, either in or out of school. So that's what I've got. Thank you for being here. And